In today's video, I'm going to discuss what you should do before contacting the most responsible provider, aka the doctor, the physician assistant, or the nurse practitioner. Let's get started. Before I begin, please consider subscribing to my YouTube channel. I'll be uploading a new video every single week. So what should you do before contacting the physician, nurse practitioner, or physician assistant? Firstly, you should always understand what your patient's going through. What is the patient's condition? What is their current status? What are they working on? You know, when you call the doctor, they assume that you know the patient very well and you've read the patient's file and you're aware of their history. So you don't want to call the physician and you don't really know your patient at all. You should get up to date with the most recent documentation that the doctor has provided, and that will ultimately make sure that you are prepared for the orders and you have a better understanding why the doctor ordered certain things. Another reason why you should look at the doctor's most recent documentation is because you want to know, what does the doctor know about the patient and when was the patient seen last? If the patient was seen yesterday, then obviously that doctor is very aware of the patient's condition. So you don't have to explain too much. And given the situation in a hospital setting, they're very tight for time. You don't want to be wasting their time. So being up to date with the documentation of the doctors definitely strengthens your conversation that you're about to have with the MRP. All right, so the next thing you want to be doing before calling the MRP is to identify what can you do in advance. For example, if a patient has really low blood pressure, obviously and they're suffering from sepsis and infection, obviously they want to fluid resuscitate them. So you want to get an IV pole ready. You want to get certain things ready so that whenever you call the physician and get the certain orders, you're able to provide effective care in a time-efficient way. That could ultimately mean saving that patient's life. So what you really want to be doing is to be thinking ahead of time. When you call the physician, you're going to expect certain orders and expect certain the doctor's going to expect certain things that you've done. Another great example is if a patient's retaining urine, what you want to do is you want to scan their bladder, get a number, and identify that, okay, the patient has this much urine in their bladder, and the best intervention that the doctor's going to provide is to put in a Foley or put it in and out. And so you always want to be thinking ahead, because you never want to be in a situation where you call a doctor and you tell the doctor the patient's retaining urine, and the next thing you know, the doctor's going to ask, okay, have you bladder scanned them? And then you have to hang up the phone, scan their bladder, then call them back, and that's just another way that's just going to cause a nuisance in your day. The final tip I have before calling the MRP is to make sure that you know the hospital and the floor's policies for nurses. Are there any nursing initiated actions that you can do, that you can provide, any interventions that you can provide for the patient that you think will help the patient? Thinking ahead of time once again and identifying the policies that are available to you to provide interventions for the patient can not only make your job easier, it makes the physician's job easier, and it ultimately helps the patient. A good example of this is to follow like the chest pain protocol. So if the patient came in with some chest pain and they've had elevated troponin, you notice that their blood pressure is high, they're symptomatic, you follow the chest pain protocol, which is most of the time. Obviously, it's different for every hospital, so make sure you check what yours is. But generally speaking, it's you give them one Nitrospray, you recheck their blood pressure, you see if they're symptomatic, you order an ECG stat, and you repeat the troponin, so you get a good understanding of what the patient's status is. Alright, so I hope you enjoyed this video. Those are 3 tips that I would recommend following and considering before calling the MRP. If you like this video, please give it a thumbs up. I would greatly appreciate it. let me know in the comments down below. What are your thoughts? What other tips do you have before contacting an MRP? Once again, I'll be uploading video every week, so please be sure to subscribe so you don't miss out. Thanks guys, and have a good day.